Aplastic anemia is a condition that occurs when your body stops producing enough new blood cells. It can make you fatigued and more prone to infections and uncontrolled bleeding. It is a rare condition and can happen at any age. It can go from mild to severe. Treatments are medications, blood transfusions, or a stem cell transplant. Signs and symptoms may include fatigue, shortness of breath, rapid or irregular heartbeats, pale skin, frequent infections, easy bruising, nosebleeds, skin rash in which your skin changes texture or color, dizziness, headache, and fever. Aplastic anemia can be chronic. It can be severe and even fatal. The stem cells is the producer of other cells, including white blood cells, red blood cells, and even platelets. In aplastic anemia, stem cells are damaged, so the bone marrow is either empty or have few blood cells. The most common cause of aplastic anemia is from your immune system when attacking the stem cells in your bone marrow. Other causes may include radiation and chemotherapy treatments. These cancer-fighting therapies kill cancer cells, but they can also damage healthy cells, including stem cells. Exposure to toxic chemicals, use of certain drugs, some medications, and antibiotics can cause anemia.
I have a question.
Ask away.
Where is stem cells? Where are stem cells located? In the bone marrow? Aren't they in the brain?
Yes, in the bone marrow.
Huh?
In the bone marrow.
Oh, what? There are ones that look like them or sound like them, but they're in the brain. What are they called? The ones that if they produce too much, you go crazy or something. Or maybe it's not related. Never mind.
Okay.
It's in the stem cells are in the bone marrow. I've never heard of in the brain. But maybe it goes to your blood and goes to your brain. I'm not sure. I don't know what you're talking about, honestly.
I've only heard of a blood-brain barrier that if that is breached, then you risk injuring your brain. Your brains have neurons, there's gray matter, your brain's pretty much a glob of fat, but it's a very valuable glob. And then stem cells are in your bone marrow. So I'm not sure what he's asking.
Yeah, I was talking about prions.
Plions?
Prions.
Prions. How do you spell that?
Prions.
I don't know. I'll have to look that up. That's interesting.
That's up.
So more causes are autoimmune disorders in which your immune system attacks healthy cells and might involve stem cells. A viral infection, some virus can cause aplastic anemia, and unknown factors. Some cases are unknown in which the doctor can't identify them. How do you know?
Okay. So connections with other rare disorders. Aplastic anemia. Okay, there's a rare disorder of aplastic anemia called this. I don't know how to pronounce it. I'm not even which causes red blood cells to break down too soon. So what happens is you do produce red blood cells, but these red blood cells are faulty. And when these are faulty, they can't carry oxygen, cannot be used. You end up with a blood deficiency. Easy. And Fanconi's anemia, funny name, yes, is an inherited disease. It's where children are born with smaller than average sizes and bones and underdeveloped limbs, and it's just a genetic problem with children that's appeared in children straight away. You can straight up see it by looking at the size of the baby. Yes. Okay, risk factors. What puts you in risk factors of this fatal disease? Treatment with high dose radiations and or chemotherapy for cancer. So this is the treatment for cancer, chemotherapy. I'm sure you guys heard of it. If you do chemotherapy, this might be a side effect, or high dose radiation, X-rays and stuff. Exposure to toxic chemicals. Basically, make sure don't put anything wrong in your body. Or maybe it's like some medications you need to look out for the side effects of each medication. Drugs, I just talked about this. This drug, chloramfenicol, I don't even know what this. It's used for treatment of bacterial infections. I was gonna say I don't know what this is, but it's used for treatment of bacterial infections. Yeah, this could be dangerous for the production of red blood cells. Certain blood diseases, such as autoimmune disorders, this is gonna pop up a lot. We need to make a topic about this. Serious infections, and pregnancy rarely puts you in risk. Puts women in risk of aplastic anemia. How can you prevent this? Easy. You can't prevent it. If it happens, it happens. Avoiding exposure. What you can do, I guess, is avoid exposure to insecticides, herbicides, organic solvents, paint removers, and other toxic elements at lower risk of this disease. Basically, if it's going to happen to you based on genetics or any disorder that's going to happen to you, these chemicals might increase the risk.
They're like triggers.
I don't think. Yeah, triggers. Basically, triggers. But there's no easy way of preventing it.